my perception of osteopathic medicine, how I view it, is kind of all the flavors of allopathic medicine, but in addition, we're learning a lot of more hands-on techniques.
Mm-hmm.
So we learn, the biggest difference, I think, is the OMM, which stands for osteopathic manipulative medicine. And that's basically treating the person with our hands. So it's kind of, it's medicine with your hands, basically. And it's thought to be used as an additional tool. So you have pharmaceuticals, you can refer out to physical therapists, chiropractors, whatever, but you also have the tool of OMM in your back pocket.
Mm-hmm.
So particularly in our field, people can specialize in OMM as well.
Mm-hmm.
So that's kind of like the big difference for me, and it's also just a whole philosophy of being kind of holistic and treating the person rather than...
I think the profession of pharmacy, like pharmacists kind of act as experts in therapeutics. So whereas doctors are required to know how to diagnose patients, pharmacists need to be aware of the drugs involved in the treatment of disease states. So when the doctor identifies what a patient has, it's up to the pharmacist to make sure that the treatment is appropriate and that it's being administered properly.
Physician assistants typically have a bit of a supportive role in the medical field. So pretty typically PAs will take over the sort of more straightforward cases. That way the physician that they're working with can deal with the more structured kind of high-level cases that require a little bit more work. So basically balance the workload a little bit.
Mm-hmm.
Again, that question, one of the misconceptions of osteopathy is I have a cousin who's a nurse. She's an RN, and she has been for a long time. She's been the medical authority of the family on my dad's side for years. So she's always telling people what they should do and this and that. And someone asked her, well, what's your cousin Ryan doing? People that knew me. And she goes, well, as I understand it, osteopathy, it's like being a physician's assistant. They go to a couple years of school and they're managed by a doctor, and I'm not really sure if it's even the same as a physician's assistant or if it's something less than that. And so I enjoyed educating her and letting her know, no, I mean, legislation has been passed just because, I mean, the guy who started osteopathy was an MD.
Mm-hmm.
And he added to it with some of his other philosophies, and so you get all the same stuff as is in the allopathic schools. And you're at the same level. There's nothing legally that says an osteopath or an allopath can practice differently, except the osteopaths do have this extra manipulation.
That we're drug dealers.
That it's easy.
That it's
All we
easy.
do, yeah. That we just dispense pills.
That we just count pills
pills, yeah.
and dispense, which is not true. I mean, for some people it is, but for a lot it's not.
Hopefully it's not.
For me,
I would say that we're kind of like the medical assistants. We don't have like the background and the skills just like physicians would have, but we actually can treat patients just like a physician. We just have to be supervised under a physician, but they don't have to be in the room with the patient. They can just be in another room serving another patient.
That's fantastic. So you could have more patients treated within a day or within a time frame.
Yeah, so
Very cool.
I think we're moving towards, obviously, a interprofessional environment because everyone's becoming so specialized that we need to rely on other people to give the best to the patient. And I think specifically at Touro is that we have such a rich environment of other professions right on campus. We have pharmacy students, we have public health students, education, and PA, and medicine. So that is the perfect platform to integrate the professions at the educational level, which I don't think is being done enough throughout the country.
Yeah, and I think it's important to recognize, especially, we've recognized this here at this school, that different people have different expertise, maybe even within your own college, but you got pharmacists who do go into more detail about the drugs. And so in the future, I see myself leaning a little bit on pharmacist friends that I've made and that I'll probably know forever, calling them up quick and saying, hey, recommendation quick, right? Rather than being in this mindset of, oh, I'm the doctor, I should know what I'm doing better than anybody else. That's one way that I see definitely integrating on that level,
right,
and being willing to say, hey, what do you think?
Yeah, I think about that all the time, actually. It's like, oh, this is awesome. I have all these people that I know that I'll be able to contact and, get different opinions from.
I believe that that will eventually be the future of how healthcare is administered. You'll be working within a team of like physicians and nurses, dietitians, and MPH people with MPH degrees who will be coordinating public health projects. So it's really important that we learn how to work with them now.
I think it's pretty crucial that we work with other people in the healthcare field. Obviously, it's pretty much like we can't really do our job without taking a sort of mixed role among us to make patient outcomes better. So.
I agree.
I am a dual degree, and the aspects that I've gained through the public health side of things, I'm intrigued at how much they coincide. I mean, you learn about medicine, you learn about it on a very scientific biochemistry, not just an individual level, but individual cell level sometimes. This drug acts here. And the public health aspect really broadens your view and your scope, that when you're doing these treatments or dealing with this specific disease, it has an impact that is very widespread. That education of the patients is another aspect that I think really has come into play here. I will be able to educate my patients so much better on several of their conditions because of the public health knowledge that they're doing.
The one thing about the MPH program I think that really will assist me in my pharmacy practice, I guess, is just that it gives you kind of a different viewpoint on pharmacy, to where you can look beyond the fact that you're treating one patient, and you can understand more that that patient is part of a community or a global population that is being affected by healthcare.
I think advantage-wise, it just puts you in a better position to sort of think about things from a different perspective than you would have if you were only going down one track with the master's in physician assistant studies. So yeah, just kind of having another perspective constantly in your mind that you can think about things with a different view.
And you can also interact with your community, like see which communities are more at need and develop public health programs on the side or volunteer on the side.